We are live. We are live. Yay! Welcome, welcome. So I am Chanel Dupree. I am a strategic connector with deep Midwestern roots that start in Nebraska, have traveled to Oklahoma, and are now firmly rooted here in Kansas. I'm an author, a speaker, a lawyer, a mama of four, and a Bible study teacher. And I am joined today with Dr. Sharla Smith. And I am so excited that you are here with us. You have such an accomplished career. I feel like you're only getting started. And we have spoken on numerous occasions. And I just want for folks to hear it from you. Tell us what your passion projects are, what you're doing. And I'm going to ask you some questions in just a moment.
Okay, well, I am Sharla Smith. I'm an assistant professor at the University of Kansas School of Medicine in the Department of Population Health. And my passion is really in Black women and infants' health, but really about strengthening the Black families, but not just strengthening them, just basically making sure that my work is grounded in their existing strengths in the community, because there are some strengths that come from the community. So my work is really centered around community engagement, to engage the community to improve maternal and infant health, and to also include paternal in there. So I want to stop having the conversation of maternal and child health in the absence of fathers, because the CDC report told us that Black fathers were 40% more likely to be involved in their children, whether married or not married to the mothers. And so I want to change that stereotype that Black families are strong no matter the structure, and that they really are embedded and grounded in the improvement of and of course the success of their children. And so I want to change that perspective so that we can really look at the strengths of the community and build on that. So my work is really in maternal and child health. I also have some work in cancer research. So I have two areas of research, but all of that is really centered around the disparities that exist in those communities.
So what I love is that you're talking about the idea and the notion and the truth that there are strengths in every community, and it's really our responsibility to figure out what that is, to harness that, to exploit it in a way, right? To magnify it, and to build upon that. So I love that you're doing that. And so when we say Black maternal and infant health, why are you focused on this for Black women?
Yeah, it's very important to me. The main reason is that when I look at the data, I realize that, my great great grandmother was more likely to survive childbirth than my nieces. And that's important to me to look at what's happening in the state of Kansas or across the country. Black infants are 2 to 3 times more likely to die than white infants, right? In the first 28 days of life. So this is in their neonatal period. And then now Black women are 2 to 3 times more likely to die than white women of childbirth. And a lot of that is associated with high blood pressure, hypertension. And so I just feel like there are things that we can do to improve the health. And I also feel like mothers are their own experts. Like, mothers are the experts of how to take care of their family. And history tells us that Black women have been taking care of their families and others for centuries. So thus there are strengths in that community. And so if we can just build on those strengths, then we can improve these outcomes.
Charlotte, okay, so those numbers are scary. 2 to 3 times more likely, and your grandmother had a greater chance of surviving childbirth than your niece. Talk about that piece of it.
Yeah, so when you look at the maternal mortality rates in the nation, maternal mortality rates and the infant mortality rates in the United States are worse today than they were 15 years before the end of slavery. And that everyone always gets very shocked by that. Like, 15 years before the end of slavery, who was keeping up with data? But the reality was the data before the end of slavery was better and more accessible than it is today, because it was based on economics and productivity. So slave owners kept very accurate data of the babies that were born, or women that lost their lives, or babies that lost their lives, because it was about the productivity of their farms, and so it was money, it was related to economics. And so the data then is better than the data today.
Whoa. That is, but you know what? So we're connecting this to perspective number three. And in perspective number three, it's called Losing a Black Haired. And it's really looking at it from the perspective of Eve, who lost really two sons, right? One son to death and then another to banishment. So we could say
Right,
in today's time, another to jail. Okay. And
right.
so when we look at that, we think about mothers who lose children, there's really no word for it in the American lingo and language. And so that's what we're talking about in the book. But for the cultural perspective, I'm tying in the Children's Bureau, which is, that's my world. And so that was created in 1912. And the reason was because a lot of the babies were dying before the age of one. So back in 1912, right, that's why they created it. And so it was to bring like education and awareness. But what happened was only white women's children began to live longer, and there wasn't that attention that was focused on Black children. And so, why do you think that there hasn't been that attention focused on Black women and Black infants through this process?
Yeah, I think, that's such a tough question, but I think historically, Black women's bodies have been exploited for medical, um, just for research, for them to identify, evidence-based procedures. When you talk about, the father of gynecology, Dr. Sims, who exploited Black women's bodies during slavery with no anesthesia to identify the evidence-based cesarean um, deliveries. And then when you think about just what has happened to Black women over centuries, is that there's this whole thing about Black women having super bodies. They're strong, they can take it, right? There's this stereotype that's developed, and then there's this lack of value of their lives. So not, we see the Black Lives Matter movement. We saw that with what happened over the last number of years, and then we so remember George Floyd and what happened. But there's this lack of value of Black lives, right? And in the reality is we've been embedding all these problems in the social determinants of health. We've been saying, well, we've been blaming mothers. I'm just going to say it. We've been blaming Black families. We've been saying if you had a better education, you have a better birth outcome, right? If you had a better income, you have a better birth outcome. If we're living in a better community, you have a better birth outcome, right? Because we embed, and I'm not saying social determinants of health are not a factor. What I'm saying is that the data tells us that even wealthy women Black women have worse outcomes than poor white women or women of other races. So the data basically tells us that Black mothers who are college educated fare worse than women of all races who never finished high school. Obese women of all races have better outcomes than Black women who are of normal weight. And Black women in the wealthiest neighborhoods do worse than white, Hispanic, and Asian mothers in the poorest ones. Black women who initiate early prenatal care in their first trimester still have higher rates of infant mortality than non-Hispanic white women with late to no prenatal care. So for centuries, we have been telling Black families, if you do these things to improve your education, improve your lifestyle, you seek care early, you have health insurance, if you do these things, you're going to have better outcomes. And that's just not true. And so we've been blaming Black families for the outcomes rather than looking at what the true historical issues are, which are centered around racism and racial discrimination, how we value them, how we treat them, how we see, hear, and listen to Black women, because Black women know their bodies. It's just about value, and it's
Mm,
about not blaming them for what's happening to them.
wow. So it's racism, right? That's
Yes,
the
I would say, yeah, I would say it's racism. I mean, we look at racism in different ways, whether it's institutionalized racism. So those are policies and practices that are in place in a system that tend to oppress a certain group of individuals, whether it's personally mediated, so whether it's biases our different assumptions, the stereotype of super bodies, right? Or it's
Mm.
internalized racism, which is that sense of entitlement and privilege, and just a sense of negative messages that we see in the media, right? When it relates to African Americans. So there's several levels of that story of race and story of racism that we just don't examine. I mean, we haven't even taken the time to figure out how Black women are processing the death of George Floyd? How are Black men processing the death of George Floyd? How are Black children processing that? We haven't even taken the time to look at that because the reality is we don't want to pay attention to the real problems.
I don't think that we process things enough. Like, I think that some situations happen, racism happens, and it just kind of becomes a part of what we expect in a way, right? Being questioned about your credentials or being second guessed or being overlooked or being stopped at the store or whatever the situation may be, like these daily occurrences that just become a part of your experience, and you never stop and say, wait a minute, that this is actually abnormal and I need to talk about this and process this. So, I don't know if, do you think that there's a large, that folks really understand like the father of gynecology and the work that he did, like, and the impact that it had and that stereotype? Like, do you feel like that conversation has been had outside of the medical community, perhaps?
I, I feel like the communities that I have worked with, those community members truly understand the historical perspective of that. And part of that is, us learning from them and them learning from us. So it's a reciprocal learning. But I don't know if we've had enough conversations about whether or not someone feels you're strong and what that means. What that means when you're seeking treatment. You get less pain medication because they feel like you can take it, right? Or you get less attention from your care providers because they feel like you're strong, right? And so I don't think we've had enough conversations about the historical perspective, what our ancestors experienced, what our mothers experienced, and what we're now experiencing. Like those things aren't discussed. Like we don't talk about, a lot of people don't even talk about their loss. If
Mm,
they lose a baby, like they never have a conversation about it. Like
mm,
it's not something you talk about, as if there's a shame tied to what happened. And I think
mm.
those conversations are not had because we feel like we're the blame because society has blamed us for so long.
You did something wrong. If you would have done these different things, then your baby, absolutely. Got it. Okay. No, that makes a lot of sense. So what what do you think is the first step? Like what can people do who are just out in the community? What are your thoughts on what is needed to help heal essentially?
Yeah, I think it's one thing is just making space, safe spaces for having conversations and sharing your testimony or your story with someone so that they can be comfortable in sharing their stories, right? And being human to people. I say that, to me it's that simple. It's like, how do you have compassion for someone? How do you support them? It's treating them as if you would want to be treated. You treat them like you would want to be treated. And so I think it takes a lot of that. It takes a lot of selflessness, and it's just focusing on others and not yourself. We're all going through things. Advocating for other women. You see a woman, advocate for them, step up for them, ask them if they need help. Um, but also working together in your community just to increase awareness around what's happening and what they should be paying attention to, because knowledge is power. So if women know these are the signs of high blood pressure, this is what you do to seek treatment for high blood pressure. If you are feeling a certain way and your doctor doesn't listen to you, find another doctor. So
Say
just
that
having,
again. Say that again because
if
we
you are
can
feeling
find
a
our
certain way and your
doctors.
doctor is not listening to you, find a new doctor.
Yeah.
We just need to make those conversations happen, and we need to be very honest with each other, even in our own lives and our experiences of what happened, so that we can advocate for others and strengthen others and provide their needs. And one thing about the church is that we always try to provide the need first and then bring you to Christ, because we know if you're hungry, we can't just bring you to Bible study, right? We got to feed you first. And so that's the same thing with the women. It's like, if you see a need,
Yeah.
try to fill that need and then try to help them to really have a healthy pregnancy. But when a woman gets pregnant, she doesn't want to lose her infant. I don't know
Right.
why that assumption is made. No one wants to lose their child. No husband wants to lose their wife in childbirth. Like, they're expecting for that woman to go into that delivery room, have a baby, come out, and for them to, be a family for the rest of that life. And so just, knowing that you need to have compassion for them, have empathy.
Yeah. No, I love that. And Mark says, awesome interview and awesome information. Keep up the good work. Thank
Oh,
you.
thank you. District Attorney Mark Dupree.
Yes, he's always an excellent supporter. And
Oh, that's amazing.
and like you were saying, knowledge is power. And so we actually had you come to our church and to share with our congregation um, the what's happening, because this really is not. It's really an epidemic that's happening for Black women and Black infants, and it just feels like there's not a spotlight that's put on it. I mean, there was recently federal monies that were dedicated to this, right? Like this was something that maybe the Biden administration is looking at doing, but
Yeah, so our vice president has for years put forward legislation to really address these issues, to address biases that happen within our medical systems, and to expand postpartum care, because we know postpartum care, if you have certain insurance, is only for 6 to 8 weeks after delivery, but maternal mortality is for a year after, right? So the woman is still at high risk for these adverse outcomes. And so there's been a lot of work towards that. And now if you expand Medicaid, a mother is covered up to a year after giving birth. So that is an automatic expansion of postpartum care in that expansion, and it was a part of their COVID relief package. So there's been a lot of discussion about maternal mortality, because that was one of the agendas that our vice president held very near and dear to her heart and did a lot of work in. I'm not sure. I think when we present rates, though, when we present rates to people, when we say, well, 10.7 out of 1,000 Black infants died and 4.8 out of 1,000 white infants died, people don't see those as lives. They don't see that as a life because they're used to hearing the numbers. We need to start to talk about these people that lost lives, right? We need to start to talk about, Dr. Shalise Wallace, who was a pediatric resident in 2020. She lost her life during delivery. I mean, she checked all of the boxes. She was highly educated. I'm sure she had a high income because she was a pediatrician, right? She was married, she was of maternal age. So she checked all of the boxes, but yet she still lost her life to childbirth.
wow.
Dr. Shalon Irvin, she had 2 masters and 2 PhDs, and she lost her life 4 months after giving birth to her daughter because she visited the ER 4 times and no one listened. It's just Serena Williams had to save her own life shortly after giving birth. These are individuals that are highly affluent, that are fighting for their lives after birth. And so I think we have to put names to the issue and stories, because we don't, 10.7, okay, that seems, 10 out of 1,000, that's not a lot, but the reality is it is, because it affects not only the child, but the husband, the family, some mother just lost her daughter. Some child just lost her mother. Some husband just lost his wife. It affects the entire family.
It's the community, right? It really affects the community. And so I love how with this, you are not just saying, okay, it's about mom and child, it's also about dad as well. And we need to engage the entire family in this. And so I know that you've been doing some work. Talk to me a little bit about the Kansas Birth Equity Network.
Yes. So the Kansas Birth Equity Network was actually birthed out of a community initiative that was started in Wichita, Kansas, called the Kansas Sisters and Brothers for Healthy Infants. And that was to bring together graduate chapters of Black fraternity and sorority members who were to create awareness around infant mortality. And so the Kansas Birth Equity Network is to bring together 50 diverse stakeholders to really develop solutions to reduce maternal and neonatal mortality. And so it's very important because we are educating, we're creating awareness among 50 diverse stakeholders. And in doing that, we've created a birth equity curriculum, which allows every sector, it looks at every sector of birth, of the prenatal period, and then also postpartum, and then also gives you something we can do in that curriculum. But it's an online curriculum, and each one of our members take that. And then we meet monthly to discuss solutions to reduce these disparities. And those solutions are going to be in healthcare systems, research, and policy, because it's really going to take changing policy to improve maternal health. Now, as a researcher and as an employee of a state university, I can't really advocate for policy unless invited, but I can create research questions that are related to policy to help improve our policies in the state. But it's really focused on building birth equity in Kansas, so increasing education and awareness, as well as creating solutions. But we also want to develop a hub for every Black family to go to our website and be able to find any resources and link those to the resources that are available. So there's one central location for that. But most importantly, we want to elevate the voices of mothers and fathers so that they are heard in our community.
I love it. Is there any like specific Kansas data that you want to share? Kansas or Missouri? Like, how are we faring in concern of the nation? Are we kind of on par or doing good, not doing well in concern of this?
Well, I think overall in the nation, the rates have improved. The disparities have not. So for Kansas, for over 30 years, Black infants have been dying at 2 to 3 times that of white infants. So while the rates have decreased, the disparities have not. And
Mhm.
now we're seeing Black women dying at 2 to 3 times that of white women. In Missouri, that's a little bit more difficult to, those rates are a little bit higher. Like Black women are dying at 4 to 6 times that of white women. So their rates are pretty higher, are much higher than Kansas. But we're not doing well, especially when we look at the percent of births. There's about 13% of births among African Americans in Kansas. And so in looking at those percent of births compared to the deaths, the rates are really startling.
Yeah.
They're deployable. And I think as a community, as a state, we should do better and we can do better, right? Which is why we developed the Kansas Birth Equity, which is why we engage in these conversations and why we collaborate, because we do want to see things happen. We do want to see change.
So if someone would want to reach out to you to maybe have you give some type of presentation or to learn more information, can they go to this website that's on the screen to do that?
Yeah, so if they go to our website, they'll be able to find my contact information there, but also a lot of information about the work that we're currently doing. And there is a short video on there that talks about the Kansas Birth Equity Network, what we're doing, and how to join. So if they're interested in joining, they fill out an interest form, and then from there, we'd invite them to participate in the curriculum. And this is a community engagement project, so we do value the community. And in valuing them, we pay an incentive for their time that they're giving to this project. So you're not paid to be a part of the project, but we want people to know that we value their time in this work and we are thankful for their participation. And so they are incentivized for being a part of this work. And so they can contact me through that information. And I'll be happy to talk with them one-on-one about this information or do a presentation, or they can become a part of the Kansas Birth Equity Network.
That is amazing. I'm so glad that you're in Kansas City now.
Thank you. It's great to be here.
Absolutely. Is there anything else that you want to share with folks before we get off?
I think my parting words is just that I don't think that we should stop until every Black mom, every Black father, and every Black baby gets to celebrate the baby's first birthday.
I love it. Thank you, Dr. Smith. And
Thank you.
information is below. Listen, if you just Google Dr. Sharla Smith, you'll find her.
Thank you.
On that
Thank
pop-
you so much. This is great.
Well, excellent. All right. Good to talk to you. Take care.
Take care.